Amantadine. Amantadine is used to treat the symptoms of Parkinson's disease and other similar conditions. It is also used to control movement problems that are a side effect of certain medications used to treat Parkinson's disease. Amantadine extended release capsule are used along with the combination of levodopa and carbidopa to treat off episode times of difficulty moving, walking, and speaking that may happen when other medications wear off in people with Parkinson's disease. It also is used to prevent symptoms of influenza A virus infection and for treatment of respiratory infections caused by influenza A virus. Amantadine is in a class of medications called adaptogens. It is thought to work to control movement problems by increasing the amount of dopamine in certain part of the body. It works against influenza A virus by stopping the spread of the virus in the body. How should this medicine be used? Amantadine comes as a capsule, extend release capsule, tablet, extend release tablet, and liquid to take by mouth. The capsule, tablet, and liquid medication are usually taken once or twice a day. The extend release capsule are usually taken once a day at bedtime. The extend release tablet are usually taken once a day in the morning. Take amantadine at around the same times every day. Follow the direction on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take amantadine exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Swallow the extend release capsule and extend release tablet whole. Do not split, chew, or crush them. If you have difficulty swallow the extend release capsule, you may open the capsule and sprinkle the entire content on a teaspoon of soft food like applesauce. Eat the mixture right away and swallow with chewing. If you are taking amantadine or for Parkinson's disease, your doctor may start you on a low dose of amantadine and gradually increase your dose. Do not stop taking amantadine without taking to your doctor if you suddenly stop taking amantadine. You may experience fever, confusing changes in mental state, or severe muscle stiffness. Your doctor will probably decrease your dose gradually. Ask your pharmacist or doctor for a copy of the manufacturer's information for the patient. What special precautions should I follow before taking amantadine? Tell your doctor and pharmacist if you are allergic to amantadine, any other medication, or any of the ingredients in amantadine capsule, extended release capsule tablet, extend release tablet, or liquid. Ask your pharmacist for a list of the ingredients. Tell your doctor and pharmacist what other prescription and non-prescription medications, vitamin, nutrients and supplement, and herbal product you are taking or plan to take. Be sure to mention any of the following: acetozolamide, antihistamines, diclofenaramide, hydrochlorothiazide with thermotrans, medications for mental illness, motion sickness, sleep, or urinary problems. Other medications to treat Parkinson's disease: methazolamide, quinine, quinidine, sedatives, sodium bicarbonate, stimulants, or uh, thyroidazine. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Many other medications may also interest with amantadine. So be sure to tell your doctor about all the medications you are taking, even those that do not appear on this list. Tell your doctor if you have kidney disease. Your doctor may tell you not to take amantadine. Tell your doctor if you drink or have ever drunk large amount of alcohol, use or have ever used street drug, or have overused prescription medications, or if you have or Have you ever had prescription unusual change in behavior or mood, mental illness, or thoughts about or attempt suicide, epilepsy, or any other type of seizures, a sleep disorder, urinary tract infection, glaucoma, condition in which increased pressure in the eye can lead to gradual loss of vision. Eczema, atopic dermatitis, a skin disease that causes the skin to be dry and itchy and to sometimes develop red scaly rash. Heart failure, swelling of the hand, feet, ankles, or lower legs. Low blood pressure or liver disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while taking amantadine, call your doctor immediately. Amantadine may cause harm to the fetus. You should know the amantadine may make you drowsy or cause blurred vision. Do not drive a car, operate machinery, or participate in potentially dangerous activities until you know how this medication affects you. You should know the amantadine may cause dizziness, lightheadedness, and fainting when you get up to quickly formal lying position. This is more common when you first start taking amantadine or if your dose has been increased. To avoid this problem, get out of bed slowly. Resting your feet on the floor or few minutes before standing up. Do not have any vaccinations without taking to your doctor. You should know that some people taking amantadine and other similar medication used to treat Parkinson's disease have developed gambling problems or had other intense urges behavior that were compulsive or unusual for them, such as increased sexual urges, binge eating, or uncontrolled spending. Call your doctor if you have an urge to gamble that is difficult to control. You have intense urges, so you are unable to control your behavior. Tell your family member about this risk so that they can call the doctor even if you do not release that you are gambling or any other intense urges or unusual behavior have become a problem. What special dietary instructions should I follow? Unless your doctor tells you otherwise, continue your normal diet. What should I do if I forget a dose? If you are taking this capsule, tablet, or liquid, take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for missed one. If you are taking the extended release capsule or the extended release tablet, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for missed one. If you have forgotten to take the extended release capsule or extended release tablet for several days, call your doctor. What side effect can this medication cause? Amantadine may cause side effect. Tell your doctor if any of these symptoms are severe or do not go away. Dry mouth, constipation, nausea, vomiting, decreased appetite, difficulty falling asleep or staying asleep, abnormal dream, headache, confusion, drowsiness, tiredness, uncontrollable tightening of muscles, change from normal walking and falls, lane like purple pattern on the skin. Some side effect can be serious. If you experience any of these symptoms, call your doctor immediately. Hallucinators, seeing things or hearing noise that do not exist, believing things that are not true, not trusting other or feeling that other want to hurt you, depression, anxiety, suicidal, thinking about harming or killing oneself, planning to try to do so, lack of interest, enthusiasm or concern, dizziness, lightheadedness, fainting or blurred vision, swelling of the hand, feet, ankle or lower leg, difficulty, urination, shortness of breath. Amantadine may cause other side effect. Call your doctor if you have any unusual problem while taking this medication. What should I know about storage and disposal of the medication? Keep this medication in the container it came in tightly closed and out of reach of children. Store in at room temperature and away from excess heat and moisture. Not in the bathroom. It is important to keep all medication out of sight and reach of children as many containers, such as weekly pill windows and those for eye drop, cream, patches and inhalers, are not child resistant and young children can open them easily. To protect young children from poisoning, always lock safety cap and immediately place the medication in a safe location, one that it up and away from out of their sight and reach. Unneeded medication should be disposed of in special ways to ensure that pets, children, and other people cannot consume them. However, you should not flush this medication down the toilet. Instead, the best way to dispose of your medication is through a medication take back program. Talk to a pharmacist or contact your local garbage recycling department to learn about take back program in your community. In case of emergency overdose. In case of overdose, call the poison control helpline at information is also available online. Symptoms of overdose may include the following: irregular or fast heartbeat, difficulty breathing, decreased urination, swelling on the hand, feet, ankle or lower leg, stiff or rigged arms or leg, uncontrollable movement of shaking of the part of the body, problems with continuation, confusion, feeling like you are looking at yourself as an outside observer, fear, irritability or aggressive behavior, seeing thing or having voice that do not exist, lack of energy. What other information should I know? Keep all appointment with your doctor and laboratory. Your doctor may order certain lab tests to check your response to Amantadine. If you are taking the extended release tablet, you may notice something that looks like a tablet in your stool. This is just the empty tablet cell and does not mean that you do not get your complete dose of medication. Do not let anyone else take your medication. Ask your pharmacist any question you have about refilling your prescription. It is important for you to keep written list of of the prescription and non-prescription medication you are taking, as well as any produce such as vitamins, minerals, or other dietary supplement. You should bring this list with you each time you visit the doctor or if you are admitted to a hospital. It is also important information to carry with you in case of emergencies. Other name: adamantine hydrochloride.